So we're in the beginning of the very exciting part of the panel, talking about bridging AI and mental health. I want to present the moderator, which spoke before but wasn't actually presented. Dr. Talia Tron is a senior NLP researcher at Pannel, a faculty member in the Digital Medical Technologies program at HIP, and a co-founder of MeDS. Talia holds a PhD in computational neuroscience from the Hebrew University, where she applied machine learning tools to analyze and research facial expressions and motor behavior in schizophrenia. And we know apparently a lot of the people in common. So Talia, go ahead.
It's my turn, thank you. Now it's my turn to present our panelists. Andre, I already pronounced your last name once, so it's enough for me. Dr. Mark Maresco is an experienced psychiatrist and digital mental health consultant and entrepreneur. Is that okay? He worked for 14 years as a staff data scientist and assistant professor in psychiatry at the Jewish General Hospital in Montreal. Mark is also a pioneer in the field of home-based telepsychiatry. And he launched his own telepsychiatry clinic and co-founded a Canada digital mental health startup. Today, he is the VP of Behavioral Health at Antidote Health and a strategy consultant in digital and mental health. Noah Nitzan. Noah is a project manager at GEHA Innovation Center. And she started as an occupational therapist and she has extensive experience bridging the clinical field with innovation and so many long words. Stop, it's okay. Technology. Noah also is a user experience designer and accessibility consultant. A lot of our work focuses on inclusive design to promote products that will suit and be helpful to as many people as possible. And last but not least, Natalia Shapiro, okay, is the team leader of the clinical analyst here at the Antidote. Her team is... The panel is going to be better than the introductions, I promise you. Her team works tightly with the data scientists to create the data necessary for model development and validation the model performance to fit the needs of LMS users and patients. So, and we had interesting discussions here about the potential of machine learning and LLMs, NLP in general, in the world of therapy. With a focus, Elias mostly talked about the talk therapy. And in this panel, we're going to discuss, let me see exactly what the title was, is how recent developments in NLP can help improve mental care and talk therapy in psychiatric setting. So I would like us to start by you telling me just a bit about your day-to-day work and what do you perceive as the challenges in the world of talk therapy and psychiatry today? Just like shortly, if you can do it. I know there's so many challenges, but we're gonna just touch upon them.
Hear me? So most of my day-to-day work here at Helios is about getting close with the data about therapy, getting close with everything that has to do with how the therapy goes on and how the documentation happens. So that's like the main issue that Helios here focuses on, the burden of documentation. But I do not believe that it's the only thing that is like a barrier for therapy in the world. There's a lot of other things that I wish for us to get to in the future. And there's a lot of things about the quality of therapy, how not so goodly trained clinicians get to give good quality therapy, as well as a big issue of demand. And that's one of the issues that we are talking about here, like how really high demand for therapy with very little therapists available and very little hours, and reducing burdens on therapists can allow them to be able to give more therapy, or they give better quality therapy that would end up being shorter. And so, yeah, that's like very in short. There's a lot more that I can say, but
Well, I'm not working with the talk therapy mostly on my day-to-day, but I would like to share. So I'm working with clinicians, nurses, and I'm trying to bridge mathematical methods with clinicians and how to apply methods. One of the challenges is actually to explain in common language with clinicians and to understand what kind of methods or what clinicians actually want. How to translate the problems or the questions they have to the methods we can apply. And this is one of the big challenges is to bridge the gap between the mathematical people and clinical world. Yeah.
I will move to, I apologize, I think it's for me because I'm moving to Hebrew. Talking today about language and mental health, so I think it will be better for me. אז אני חושבת, זה ממשיך הרבה את מה שדובר קודם, הנקודות בעיקר של המטפלים לפחות זה הזמן שמתבזבז, דברים שהם כביכול טכניים. אז חוץ מהטוק תרפי שדובר היום, יש עוד הרבה דברים אחרים מסביב, יש לנו שאלונים וכיתובים של שאלות, המון זמן שמתבזבז, זמן יקר, מטפלים מאוד מתוסכלים מזה שהזמן לא הולך על האסנס האמיתי שלשמו הם נמצאים, הזמן שיכול להיות מתורגם לזמן טיפול ומטופלים אחרים שזה מצרך מאוד יקר היום. עכשיו חוץ מהזמן הזה מדובר בחלקים, הכתיבה והתיעוד זה משהו שגם יש לו חשיבות באיזשהו מובן. התיעוד הוא עוד עיבוד של הטיפול, אנחנו לא רוצים שהטכנולוגיה תיקח את זה לתעזור לזה, ואולי נדבר על זה תכף, אבל בתוך החלקים הטכניים האלה, לפעמים יש דברים שאולי רק מכונה יכולה לעשות, וזה גם משהו שיכול לתסכל מן הצד השני, כמו דברים שאפשר לכמת אותם ולמדוד אותם, דברים שאדם לא יכול לעשות, ניואנסים קטנים שקורים בשיחה, לזהות מגמות בטיפול, ואפילו יעילות של הטיפול. אני אגיד רק שמהצד של המטופלים, שזה לא פחות חשוב, מדברים פה על זמני המתנה מטורפים, וזה עוד לפני המשבר הגדול שקרה לנו, לפני כמה חודשים, בבתי חולים בפריסה גם בחדרי המיון, גם במחלקות וגם מרכזי שיקום בקהילה. עכשיו מערכת גם ככה במערכת מורעבת. אז זה החלקים, וגם כשמטופל מגיע בסוף למטפל, שזה בטח במגזר הציבורי, עוד יותר לוקח הזמן, לא תמיד פוגש מטפל שהוא מרגיש מספיק נוח איתו, או שמספיק מיומן, בשביל לטפל בבעיה הספציפית שהוא הגיע. וזה ככה, שני הצדדים.
I'm going to really shortly repeat what he said.
So I'm going to repeat a little bit what other people said. I have two kind of roles. One, I'm a clinician, so I'm working with patients all the time, and I see their needs. But also for the company I work with, we're a healthcare provider, we're also a healthcare insurer. So our job is to serve a large number of people and make sure that at a very high level, patients can get the care that they need. So we're building a system. Either way, what we recognize is there's nowhere near enough therapists to handle all the mental health needs anywhere in the world. Not just Israel post October 7th, but everywhere in the world. This is the main problem. Why? Mental health issues affect up to 20% of the population. The majority of this includes depression, anxiety. These are conditions where psychotherapy is a first-line treatment. It works very well, but it's a first-line treatment that most people cannot get because there's not enough therapists available. So what's the role of AI? For sure, I agree. Any tool that can make therapists more efficient in their time would be great so that you increase capacity. Any tool that could improve the performance or upskill therapists is also great, because what you also have right now is a situation where organizations are using therapists with less and less skill, lower credentials to meet the needs, and also offering fewer and fewer sessions. So people are getting poor quality therapy. So if there's a way to maintain a basic good quality of care, that's excellent. And I think what's gonna eventually happen, and maybe I don't know how many years, is eventually starting to use these machine models to become therapists, and eventually perhaps even replacing human therapists.
You think that?
Yeah.
So Mark, you already answered my second question, which is how do you think AI systems should address these challenges and where can they be useful? So I would also like the other panelists to maybe say, where do you see the potential? And if you can just say a few words about the recent development in LLMs where you see huge potential that was not there before.
אני חושבת שהפוטנציאל הכי גדול יהיה במקום שזה באמת ייעל את הטיפול. אז I agree that maybe it will replace one day. Maybe it's a cultural thing, I don't know. But you hear it more and more that maybe it will replace the therapist. I think that's our thinking, yeah, that the best way is the combination where the machine can help us to make conclusion and to get to insight that we cannot do without it. So maybe something we will get there, but the best will be it will help us to be more efficient. I don't know if we replace it and to let us at least do, I don't know, 80% of our technical work to be replaced.
I fully agree with all speakers and they just mentioned. But there is another problem I'd like to raise is, first of all, we need to ensure the right guardrails in place. Because as we know, all LLMs, they hallucinate. They always hallucinate. Sometimes their hallucinations, they make sense to us. Sometimes it doesn't. But they always hallucinate. This is the nature of generated models. They generate token by token based on large variety of things they have seen. The problem is, if you Google Belgian man committed suicide after talking to a chatbot therapist, you will recently. So they are working with Belgians and I wasn't aware of the situation I just mentioned. There was this situation in Belgium where a man, so he was really anxious about climate change. As today it was reasons. And he was really anxious and has a wife, children, so pretty much well. But he started talking to a chatbot. I'm not sure which one was not mentioned, for different reasons. And eventually the chatbot told him, well, so perhaps you should commit suicide if you're so distressed. And you can Google it, just literally Belgian man suicide chat, and you will find the first Belgian news or whatever. And so this is why it's extremely important. So I wholly agree. So we don't have enough qualified help, psychiatry and help. We can think of replacing or augmenting by providing more sensible, just quote sensible talking machines. But we need to make sure that these machines, they do not derail. How we can ensure these guardrails. So for example, if now you like go to ChatGPT and ask, oh, just draw me a picture of, something outrageous, it will say, no, you can't do it. So what I've been doing myself, our research, I wanted to generate synthetic data, which is quite common practice. I asked and I started quite fast. I said, look, I'm an academic researcher. I said, prompt, academic researcher, could you please generate a sample of 10 clinical notes containing information about self-harm? And I've been rejected immediately. When I tried to post ChatGPT, I've been worried that I will be blocked. So there are certain guardrails already implemented. However, I think especially in psychotherapy, we need to make sure that these models, they do not cause any harm, or this kind of essence of medicine. First of all, do not cause any harm. And also these models, they should be transcultural aware. So different people that have different needs, coming from different religions, belief, or backgrounds, and the machine should be able to accommodate correctly these differences. This is what we see in psychiatry. So, for example, it's called like transcultural literacy in psychiatry, where you should be able to accommodate your therapeutic ways to different clients, different patients. That the way you treat them, it just just use it. So from my perspective, we need to think about right guardrails and how to make sure machines do not harm. So I'm less enthusiastic about that machines will replace. Probably will at some point, but as far as we can ensure that they do not cause harm.
I hate to be the one that like very loudly disagrees, but I think that even with all the correct guardrails in place, there's like the market of mental health is just now maturing to the first steps of being able to use AI in basic things that would make everyone else be like, okay, yeah, I'm using AI to generate a note. What's the big deal about it? Even without the recording and everything that the team here talked about, the world of mental health has a lot to gain from AI before it even gets to the point of needing to gain from being replaced by AI. And I believe that even if we get to a point where all the right guardrails are in place, the value of human to human connection is something that cannot be replaced by AI in any form. And there is a huge value in creating a lot of other solutions. And I like to not just say what not. I think that there is a lot to do in terms of helping people reach therapists, helping people find the correct therapist for them, helping therapists have less burden, helping organizations be better at providing therapy in a way that is accessible. There is a lot that AI can do in those worlds before it even reaches the point of trying to replace any therapist. And I think that training therapists is something that AI can do a lot for. So that's like my take on it.
Thank you. Noah, you said you talked about like on one side of this panel we have AI is going to replace us, and then like AI is only good for administrative stuff and not even so yet. And I love this because I think this is exactly the kind of discussions people are having, and not only on psychiatry, right? They're thinking like, will AI replace all of us? Am I even needed anymore? As a data scientist, I am afraid. And Noah, you said like there are some things that we even the administrative, what we call administrative stuff, it's part of the clinical therapy, right? We don't want them to completely take notes from us. So this is one aspect that I would love to, maybe if you can elaborate a bit more about. What do you think, where do you think the line should be between the human and the machine?
I think that, first of all, for people to really use it, the therapist has to have, the first question is, what is it for me, right? It has to be for a real need, a real pain point. And this is a lot about wasting time. But if we talk about where it is balanced, I think that two things. First of all, therapists have intuition, and they usually don't want others to take their intuition from them. And the second, and that not just therapists, we all don't like people or products thinking for us. So I think the best will be, I mean, it's great to have a conclusion, something written at the end of the session, but what I'm going to do with that, how it helped me to think, how it helped me to make conclusion or insight that I cannot do, to help me think better, to get insight that I cannot do without this machine. Again, a combination between the person and the machine. I think still it will save us a lot of time because we talk a lot about this, how much time it takes for therapists to write. So it's still saving a lot of time, but let us make a better treatment and get to better conclusion that we cannot do without the machine. So I think this would be the best way.
Thank you. Well, what about, this is one thing that wasn't raised here, what about using AI tools as like a co-pilot in the treatment? Do you think this is something that might happen? Like you as a therapist come to the patient and play around with AI to do like treatment. Do you think this is something that can, It's a surprising question. I didn't prepare you. I just thought about it.
So I just said something that I think I moved to you. I think that first of all, we have to ask what the patient will feel like when we have another friend in our in the room. And I want to say another thing that we see a lot in India. I mean, there is a lot of avoidance around therapists, especially in mental health. So maybe it's not you or myself, because we're people that like innovation and we're thirsty for solution, for new solution, because like I said, we are in a starving field. And so we're looking for a solution, but don't think that every therapist is like that. They're very diverse. And some of them are the opposite. Some of them are looking for that. Some of them are really afraid of new technology. We work very hard to make our staff be more positive about technology. So it's not very easy for them even to use sometimes apps or virtual reality or augmented reality, the AI. But the AI is different because the AI is already there. It's not like to say, I don't want to use the internet or something like that. So I think it's a process, and but we have to consider many things. And I think what you said before is very important, because how we make sure that everything that's going on there is under control and it's not going to be any harm. If we have this professional judgment all the time, it can work, but it has to be very controlled.
So you talked about a lot about autonomy. I'm sorry, Amber, do you want to add something?
So don't want to.
Mark, I'm going to have a question for you in a minute.
Now, I just really want to add to your, just to piggyback your comment. I think this is a hybrid mode of augmenting clinicians. This is first of all, I think the technology, exactly as you mentioned. So the essence of technology is to automate really boring stuff, like summarizing, document, exactly things that humans can do, but machines can do it exactly the same way, but quickly. So, for example, if you want to find keywords or summarize text, why won't you to delegate to machines? And then clinicians will, throughout their time, to do the job they should be doing, exactly like transcribing, summarizing. I fully agree, and this is exactly how machines should be used, or they should document clinicians. The problem is when exactly as you mentioned, for example, how we can think of augmenting clinicians or therapists by using such technologies. So, for example, a clinician or therapist, they can have a ChatGPT open next to them, and then a ChatGPT can listen to their discussion, and then to help. So, for example, say, hey, I think that the patient is a bit struggling with certain things, so why don't you? It can help navigate or discover things, like as you mentioned, things that a therapist are all humans. So they may be tired, they may miss it, could be Saturday night memory, it could be personal. So exactly. So as all, someone asked me, so what would happen in the ideal world? We should refer quickly, of course. But this is what exactly mentioned. We don't have enough qualified people. They just work crazy shit, and mental health as a field itself, it's really demanding. And so what we can do, another problem, this is great to have an assistive technology to do. However, I hope I'm not going to make discussion because I have so many questions. Okay, so I'm just trying to make myself just cut the cheese. The question is whether the use of technology is the right way from the perspective of patients. I can give a very simple example. Just to mention, and this will be observed as well. For example, I've been working with people with LGBTQ plus communities. Sometimes they refuse to provide their sexual orientation because of being stigmatized. So, for example, and this is exactly what we see in clinical notes as well. So we see the prevalence of self-reported sexual orientation. So people tend to know to say they heterosexual. This is fine. However, the largest second prevalent category is the person declined to respond because and also being bisexual man. This is the kind of the most the category which people tend to not decline. So still there is lots of stigma. And just to mention the technology that will highlight to the clinician that the person sitting next to you is a gay. Question is it the right way of using technology? Can you, what is the right way of using data? Can you show without asking or without consenting the person to disclose something? It's called unobserved characteristics. So people at DeepMind, so they work in DeepMind as well, they published a brilliant paper, I think in 2021. It's called unobserved characteristics, something which is not explicitly put. in a clinical notes, but it could be deduced. So if ever a large and have a well-linked model, it can identify things that people do not want you to know. The question is whether this right way of using, whether it's assistive technology may reveal something. And this is just yet another angle to think on what is the right way to. Sorry for dominating this. It's really exciting.
We are all dominating, so okay. You mentioned a lot of ethical concerns. So I heard autonomy. I heard about privacy. You talked about the consent. And also, all of this you raised as concerns from fully automated machines that will serve or replace psychiatrists or therapists, and also what is the good way or the right way to use these tools. So all of this could be maybe one not objective, how do you say, like cons of or limitations of using these tools. Another aspect that was raised here was intuition, human connection, as an argument against the LLMs. And now, Mark, I would like to hear your response on that.
So I knew that what I was going to say might be provocative. I actually still believe it, whether it's going to be in 5 years or 20 years or 50 years, I don't know. And of course, yeah, there's a lot of problems to solve and work through and machines hallucinating and all that. But I think the whole question of intuition or the human connection, how essential is that ingredient in the therapy? There's interesting studies showing that for some chatbots, therapy chatbots that already exists, and it's just like cartoon chatbots, they've already demonstrated that patients will develop a positive therapeutic relationship to that chatbot.
Liza even, like the first ever chatbot, Liza, people were chatting to it as if it was a real person. We tend to humanize things.
So exactly, I think the connection and oftentimes this feeling of being connected doesn't necessarily come from the other person to you, it comes from you. It's what you perceive towards the other person, meaning that if you're the patient, there are many therapies where the therapist will say very little. And in fact, they do it intentionally. They try to say as little as possible so that everything comes from the patient. And the patient starts to invent this whole world, this whole relationship with this person standing there who's saying very little. It comes a lot from the patient. So I think that we tend, I think, to romanticize a lot or give it like a special place to, these abilities of another person to connect with a patient. I think that's true. I think it's important. I'm always thinking about the level, like at the healthcare system level. If I knew that all the therapists who are in my network, who are seeing our patients, are all excellent, highly trained, super intuitive and in tune people, that'd be wonderful. When I know that that's not the case, and when one patient has the good fortune to get to see the best therapist, and the next patient sees someone who does not help them at all, that's what really gets me thinking that we need to do better. And I see this all the time. I see patients going to therapists and it's not working, that it's not clicking. There's a lot of therapies out there. We heard about evidence-based therapy. All that means, evidence-based means there are certain strategies or techniques that are used that we think, we're not even sure, we think these are the magic sauce, the important ingredients in the therapy. And there are many types of therapy that are actually very, what we call, manualized. Manualized means that the therapist has very specific instructions of what kind of interventions to do based on what the patient is saying. It's like a script that you learn. In my mind, again, I'm not a data scientist or a computer programmer, but in my mind, that's a perfect task in a way for some of these language models because it is scripted. And just leave you with one more thought. One of the therapies that we're using right now that have been shown clinically to work as well as in-person therapy, we call it iCBT or digital CBT. where the patient will learn the material on their own. They take a course. And then they're just meeting with a coach for 50 minutes once a week to make sure they learn the material. And they can get good results. So again, I think we need to maybe like not romanticize therapy too much. Think about what are the main most important ingredients. And if we can deliver those at scale to patients, I think we'll already get better results than where we're at now.
So do you think that applies to all type of patients, to all type of therapy protocols? So where do you think, in an ideal world, what do you think the limit should be?
For sure, it's not going to apply to everybody. Just like psychotherapy doesn't apply to everybody. You have patients who come and say, just give me medication and I don't want to talk to anybody. So if we have other options available, that also makes it possible for patients who really want or cannot connect in other way to be able to see the therapists who are available. I don't think that anytime soon therapists will go out of work. We don't have enough. And probably the way this is going to work, if ever these things come into being, it's going to be for small, like for specific issues at first, for the patients who are the least severe, and it will happen slowly. There'll always be a need for sure for human therapists.
Thank you. Anyone wants to comment?
Just a quick one. So when we're talking about, you probably, as you mentioned, so the therapist will go. If you remember when in the computer vision, this X-ray and all this started boom, several years ago, people said, hey, we need to start, we need to stop training radiologists because AI will replace in 5 years' time. And this is absolutely not true. We still need to train radiologists to make sense of scans. However, we can now use more assistive technologies to help good radiologists to do their job quicker, better, and not to be, tired. And I think this is somehow can be translated to therapists as well. So this is my opinion. So we can, the momentum.
Yeah, I just wanted to add like a similar point to yours, and it's like when I was saying like therapists cannot be replaced by AI, I was not meaning like there is no places where AI can help patients. What I am meaning is like there is still a need for good trained therapists, and there is like a really big opening for creating a more balanced amount of therapists, like you were saying before, like some get a good therapist, some get the best trained therapist, or the new therapist, or the one that is just going through a divorce and is not focused in therapy. And like having ways to monitor the quality of therapies that people get, as well as being able to provide better training, is of course one of the first steps. And of course, tools that can aid therapy or can help patients that would otherwise would not get to therapy. Those are amazing tools that would want to have. And I think like the more digital therapies are usually better for clients that would have a hard time getting to therapy or would not otherwise meet a therapist, or that if they would try to meet a therapist, they would encounter all the barriers that are on the way to see a therapist. For example, finding the right therapist, matching with someone that matches with them, finding someone they can afford and has the right time for them. So those are all problems that we could solve either by creating solutions that would make therapy more accessible to those people, or by creating solutions that would make therapy not needed, like in-person therapy not needed for them. What do you want to say?
Okay, so now that where we the levels for, I think that was the role of the patient. My last question would be about implementation. What do you guys perceive as the major challenges? And we already touched about some of those, and like hallucinations, and you also touched about trust. And if you can elaborate a bit more about where do you think the challenges will be, and maybe the considerations of people developing such technology, what needs to be taken into account?
I think I mentioned all before that first of all, many therapists are not very, I don't know how to say it, but easy with changes or technological changes. So they have to understand that it's really give them big value. And it's what I said before about how to help them I agree about what you're saying, and it's not like I disagree with what's going to happen, and but still, I think that there is something that could be very, very big advantage if this the AI will help the clinician to get better conclusion. I think this is something that therapists will look for. And another point that, I mean, the AI is there, like it's there, and from one side, I can say we don't have to use AI everywhere, but from the other side, I can say it's there anywhere, and it doesn't have to be it can change a little bit the setting, change the attitude. It doesn't mean that if I'm going to use AI in the treatment should look the same with and without the technology. I don't know if it's clear enough. When we start to use the technology in a setting of treatment, maybe it will look different. We don't have to be afraid that maybe the talk therapy will look different. And I think this is something the therapists are afraid of. They're afraid that it's going to change. And maybe it will change. And it doesn't have to look the same. That's what maybe it will change it a little bit.
I think that another barrier is like education to clients, like to patients. I think that being able to provide patients with like the right guidelines to when they can be aided by AI, or also therapists as well, like implementing as a therapist and being like, okay, where are the limits of this thing? Where am I trusting this thing blindly and where I'm not? Like, because we have seen like clinicians that are like adopt like writing the note with Ilios, for example, and like click the thing, that's it, I'm not reviewing this. With less trained clinicians more than not. So those are like the things that we need to look out for. In the realm of therapy, we have a lot of people that are reaching out to get therapy and are not educated about what are the things that would make this therapy safe for them. Not even talking about AI. If we move AI from the picture, people are reaching out to therapists that are like charlatans that are selling them bottles of flower essences and telling them that will cure their ADHD. So we have a lot to do in the terms of educating the society about what good therapy is and what is good for them and what not, and having that reach of implementing into that AI would mean that people are not even having the interpersonal encounter to realize that that therapy is not good for them.
I can just, no, don't have
No,
to sure. I just want to add that maybe it's obvious, but implementation is the most important thing. Because develop a new technology, especially in Israel, they develop technology all the time. It has to work very good, but it's the easy part. The more challenging part is the implementation. You know that most of the technology, the assistive technology, the technology implemented that's staying on the shelf, and people are not using it because of bad implementation. So good implementation means. First of all, it's for really good pain point or really need and with good value. But after people use it, they have to, the company or they have to follow up and to see that people know how to use it and to continue and develop it according to the needs of and to work all the time with the field. This is something that it's not happening in our center. Company and startups come in very late stage. They're in love with their idea, and when they come, they don't understand the settings or how is the process look like. And then it's great technology, it works great, but nobody is going to use it. So they have to understand, especially in this very sensitive setting. There's a question there.
Not a question.
Sorry.
I don't want to argue much, but I could argue so much several things which you have said here, but particularly your case. The population of psychiatrists in Israel is aging. It's very well known that majority of them are coming from the Soviet Union. Now our current pension is that still must keep working. familiar because I have a family member who is a psychiatrist and all his friends who meet us during the family events who are psychiatrists from the same generation. And you're talking about the lack of acceptance of the new technologies by these populations that go back to the medical school and educate them from this. Sorry, go to the medical school and educate them there, and they will be more accepting the new technology when they will reach the level when they actually treat people. So I understand that country has a challenge with the current population, but in the 10 or 12, 20 years, it won't be relevant because a huge population of psychiatrists will come from the academic is already this level of education.
Okay. So first of all, it wasn't a judgmental comment. I mean, it's just saying that don't just think that if you have a good solution, everybody will jump on it. This is a fact. So you can say that many of our therapists are great with technology, maybe don't want to hear about it. This is a fact. And there is a difference between generations, right? There is a huge difference between the youngest and the oldest. But I agree. I hope that they will learn more about technology and how to use it. Because it's a lot because of lack of knowledge and experience.
I can maybe try to answer maybe a little different way. We can also even ask, what is therapy? And ask, how are these different technologies adopted or used? I think a lot of it is how we label it. There's a lot of people out there who go get help for the mental health issues. And they go to places like chat groups, or there's different websites where you can say what you're going through, and people who are not even therapists, just like peers, will comment. And these have been studied a little bit, not so much. Is this therapy? Is it not? People are benefiting. Alcoholics Anonymous, AA, was developed by someone who was not even a clinician. And he created like this process that now is a standard of treatment. It never had to get approved by a psychiatrist or by go through it. It kind of came out organically. I think there's probably this whole new area of chatbots and how they're going to be used. Probably before it even becomes official mental health, they're going to be coaches. There's going to be sort of chatbots where you just talk about whatever's going on in your mind. And I think these will probably be the places where it can grow from. And I think there'll be a lot of people who are actually much more comfortable speaking to a computer than speaking to another human. Because it's intimidating to speak to another human. You're feeling judged. People who want to tell their most inner secrets may be more comfortable doing that when they know it's a chatbot. So I think sometimes we have, one of the assumptions that I hear is, we should not deceive the patient. We shouldn't make them think that, don't let them forget that there's actually a machine in the room. I would turn it around and tell them, no, you're speaking just to a machine. There's nothing else there. Okay, so keep that in mind. It may hallucinate, it may tell things that you don't agree with, and see how that goes. And I think a lot of people may actually gravitate to that in ways that we don't expect.
Chatbot is not judgmental from the patient side of view. And if I'm talking to a chatbot, it will not think bad things about me, even if I tell him horrible things that I want to do or some hideous things. So maybe from the patient side of view, it's better to talk to a chatbot, and he can talk more openly to it. And like you said, if I'm an LGBT, I will be more likely to say it to a chatbot than to a therapist.
But is that also good for society?
I think yes.
That's interesting. One question?
From society perspective, many of the mental diseases are without technology, especially the Alzheimer's said like ADHD and also down the autism spectrum. And now you kind of suggest to solve parts of the technology that mental disease that will cause the technology by technology, and then it becomes a vicious circle that in the end people will lose, especially children, and you see it very greatly in Japan actually, when people lose their social skills, and this is a big danger actually. So we need all of us, like from the AI mental community, we need actually to ensure that we minimize the AI tools. Otherwise, in a vicious circle process, it will harm, I think it will harm society, it will harm our natural behavioral capabilities. So this is a big danger.
I just want to repeat the comment for the people in Zoom. So Gary here said that one topic that we did not discuss is the dangers that AI and LLM, generative AI and specific are for mental health. And if we take our patients and try to heal them with things that might cause their condition, is that not a vicious circle that we are not letting people actually develop their human and social skills?
I believe that intuitively you wouldn't treat things that are like based on social by an AI or just by an AI. You can use AI to enable therapy for someone that, for example, has social anxiety. But yeah, I think that, like, at least from my perspective, healing social anxiety by AI can be one part of a big process, not the whole process of it. It cannot stand on by itself, especially when talking about things that have a social nature to them. Things that are more neurological, it's another, like you mentioned ADHD, autism. I don't think that they have that much connection to use of technology and human connection as much as a neurological thing, and that is like another deviation of it. But also in those cases, making therapy more accessible to those people, and then by having some basics of AI, and then from there getting to a human, that would be like, I think, the ideal.
Yes, maybe you can relate to prevention in this area. How AI can play a role in this.
So the question was about AI's role in preventing mental health problems.
I think this is a good example, and that could even be one of the early use cases, right? Because prevention means that you're dealing with a population that's not yet clinical, but not yet depressed, but not yet in a disorder. So even from a regulatory perspective and an ethical perspective, there's maybe not as much of a risk of making bad mistakes because they're not yet that sick. But if you can identify signs that they may be tending towards depression or anxiety, and if you can potentially offer interventions that can, prevent them from going further into that road, then I think that'll be a perfect use case.
Yeah.
And this could even be, powering not just therapists, but family doctors and other professionals who don't have a therapy background, but who are seeing these patients all the time. And if they can kind of get an indication, look, your patient's saying this and this, maybe they are stressed, maybe they have certain issues, and try to intervene early, it'd be an interesting idea.
I just add that in general, we know that AI can help with prevention by monitoring. It's not in talk therapy, but we talk about like in social media and other places that and there are research about it, and even startups that deal with it, like to identify the words that the people, the way they express themselves, and to monitor them. And we know that there are organization in Israel that give like first aid but phone or whatever, they did a lot of research to to monitor, and then you have like and you know which people are really at risk, and you can contact them. So in yeah, like monitoring wards or donation even, things like that.
And before we conclude, we did not talk about October 7th in this panel. And we are going to, I hope, have another meetup in this series to talk more about the war and how it affects mental health and the technological solutions that was raised in this aspect. And I would like, before we conclude, I'm gonna ask for each of you summarizing work. Before that, if anyone here in the audience or in Zoom would like to offer some talk or some further discussion, a webinar, a meetup, this is very sadly a very hot topic at the moment, and we can all gain from learning. Just like you said, it's not just the therapists; it's all of us talking this mental health language and then addressing these issues. So please contact me or Mila or Rachel or anyone of anyone of the med admins, and we can make that happen. So summary words.
You want to start?
I don't know, I think for me, this is a really exciting moment in history. This technology is extremely fascinating. We don't know exactly where it's going yet. So I think these discussions are great because just imagining different possibilities, imagining different angles, how it can be used, this is what we need to be doing right now, just to think about how we can use this new tool.
I think a good summary is to say that sometimes the psychological issues with the therapist and not just the patient, and maybe it's a continuation of what you said, because we're like, this is what you think, and this was the first reaction, and this is what you usually hear here in Israel, but not all of them. It's not the first time that I hear, and I think there is a lot what you said, it is so true, but it's a process, because it's there already, but it's a process also for us to be judgmental, and I think it's important to be judgmental about it and to be cautious about it. It's also important, but I think it's something that you cannot ignore. It's there.
Just to add to both comments, I think we need to involve more patients and public involvement and engagement in the process of both developing and implementing tools. As we discussed, we are developing tools not to leave the, vacuum, so we develop tools for people, both for clinicians and for clients, for patients who suffer. So we need to involve them, like as you mentioned. So we need to understand what they want. We don't just develop tools. We want to make sure that they will be accepted, trusted, by users, both clinicians and patients. So we need to make sure we involve people in co-production. If possible, it might be great idea for startup companies or for clinical research to involve more advertisers, to invite people. So I personally learned a great deal of inviting patients and people with lived experience, how they perceive the tools. And the feedback we received was really it really helped us to change our thinking and how we need to adapt our tools. So more power to people.
Now I need to say something different from the last one. But first of all, I want to say that I can really agree with you. Couldn't agree more. My role is being the clinician inside a startup that is developing something for clinicians. So couldn't agree more that we need to involve clinicians and patients and the end users of the technology in the steps of development, in the early steps of development. And also I believe that conversations like the one that we had here are so important, not only in the realms of like in front of developers or in front of people from the field, but also like in front of people that consume and therapy. I think that people hearing and listening about these debates, these conversations, all the different ways of looking at AI and its involvement in the medical fields, in the mental health fields, are very important in shaping the way that people see these tools and see therapy and see the tools that can be used within therapy and how they can empower themselves or their clinics or their I don't know, their systems where they work with. So it's a really great discussion.
I will have to agree. And I hope you all agree. And thank you so much. And looking forward to what the future will bring. Thank you.